Go.
Okay. Come in.
Good. Hi, how are you?
Good, how are you?
Pretty good. I'm Elena. I'm going to be your nurse today. I'm going to be doing your head to toe assessment. What's your name?
Matthew, the last one.
Can I check your...
And up.
Okay. And can you confirm your date of birth, please?
May 10th, 1991.
Okay. And where are you at?
At the hospital.
Okay. And what town are you in?
Ocala, Florida.
Okay. And what year is it?
2016.
Very good. Patient is alert and oriented ×3, and speech is clear and appropriate. Okay. And I'm going to provide for patient privacy. I'm going to close the curtain here, and I'm going to wash my hands. I have on gloves, and if anything I do hurt you, just let me know, and I'll step back to your side and figure out how to do it differently. Are you in any pain right now? Is it okay with you if I do this?
Yeah.
Okay. Now, first I want to look at your face. Okay. Can you look at your for me? Can you smile for me? Can you raise your eyebrows? Okay. Can you puff your cheeks out there? Thank you. Okay. And now I'm going to look into your eyes, and I want to just check your pupils and make sure you can still see. Now, does that hurt? If I do that? Okay. Okay. And can you do me a favor? Will you please look over there at the curtain on the wall? Okay. And now I want you to look at the tip of my lip. The patient has appropriate and intact bilateral prolapse. Can I look in your nose, please? Okay. This patient's nose is appropriate and has no discharge. Can you close one side of your nose and breathe in and out? Okay. Patient is able to breathe out of both sides of his nose as appropriate, and his septum appears to be intact. I'm going to check your ear. Is that okay? His ears are appropriate with no excess discharge. There's no redness or swelling notated. And now I'm going to whisper. If I whisper on one side, I'm just going to whisper low. Just tell me the word you think I said, okay?
Watch.
Okay.
Wood.
Okay, very good. Patient's hearing is intact, and gross hearing is intact and appropriate. Okay, let's see here. Here, your mouth on this one. And can you see under your tongue? Thank you very much. Patient's mouth mucous membranes are intact, pink, and moist. Okay. Now I'm going to palpate your pulse. Would it be okay if I touch you? Okay.
No obfuscations. Mucous membrane moist. No obvious scarring, no scars. Appropriate, because size is appropriate. Can we sit up?
Okay. And now if it's alright with you, I'm just going to palpate your pulses on your feet. Would that be okay?
Yes.
Would it be okay if I took your socks off?
Yeah.
Okay.
And breathe in.
Oh, those are good ones.
Yeah.
I palpated the posterior occipital, and now I'm doing the dorsal pedalis. Patient has a good pulse in all of the pulse regions at a +2, and it's equal bilaterally. Okay. Now I'm going to wash my hands again, because I need to touch the points on your face. I forgot to do this. If you would, just close your eyes. I'm going to touch your face. Is that okay? And when I touch your face, I want you to say for me out loud the part of your face that I'm touching.
Forehead. Cheek. Right cheek. Chin.
Keep it up there. Sorry about that. Okay, let's see. Now I'd like you to hold your arms out straight for me. Okay? Hold them up to the side. Okay. And hold them back behind your back. And cross them over again. Okay, and then go back out. Now I'm going to push down on your arms. When I push down, don't let me push your arms down, okay?
Nice deep breath.
I'm going to push up on your arms. Don't let me push them up. Very good. Can you hold your hands like this like you're a boxer? want you to push. I'm going to push your arms towards your face. Don't let me push
I'm
them.
gonna listen to your heart.
Okay, I'm going to pull them towards me. Don't let me. Okay. And I'm going to push them apart. Don't let me.
sarcasm?
And then I'm going to push them together. Don't.
Alright. Because I
Wow,
always want to
patient
do
is
the opposite.
very strong. 5 out of 5. Bilaterally
So,
equal
anyway.
with no noted
Second.
deficiencies.
Intercostal
I'm going to do
space.
something similar to your legs.
Right.
Okay, would that be all right?
Yeah.
Okay. First I'm going to pull them towards me. Don't let me pull them. Okay, now I'm going to push them towards you. Don't let me push.
Intercostal space.
Okay. I'm going to push your legs together. Don't let me. Okay, now I'm going to pull them apart. Don't let me.
Third intercostal space.
Okay, now I'm going to push your toes down. Don't let me. Now I'm going to pull them up. Don't let me.
Fourth
Now,
intercostal
I need you to
space.
take your
Left
hands
sternum forward.
and go like that. Rotate it. Okay. I need you to take your ankles. Rotate them. Now wiggle your toes.
Alright.
Perfect. Okay, can you take your head and rotate it backwards? Can you rotate it forwards? Can you rotate it to the side? Or can you rotate it to the other side? Okay. Any discomfort with any of that? Can I touch your toes and your fingertips?
Yep.
I want to check for what's called capillary refill. Okay. Put your feet up here.
Good. Your balance is good. And can I have you walk right there?
Wow, you have great capillary refill. Very fast. That must be because you're so young, right?
Yeah.
Can I have you lay back down?
Okay.
Are you comfortable? And I'm going to go document my findings and wash my hands. I like it.
Okay. Patient has appropriate and bilaterally equal capillary refill in less than 3 seconds, as would be expected with proper circulation. Would it be okay if I listen to your heart now?
Yeah.
Okay, it's a little bit chilly, but I'm going to try to warm it up some, okay? Okay, now, first heart sound that I want to hear is going to be in the second intercostal space to the right of the patient's sternum. It's going to be what we call the aortic sound. Nice S1 and S2 there. Okay, now, the second sound I want to hear is going to be, there it is, okay, to the left of the patient's sternum, and that's going to be the pulmonic valve sound.
That's what I mean.
The next sound is going to be in the third intercostal space. It's going to be to the left of the patient's sternum, and it's going to be called the Erb's point. Okay, the next sound will be in the next lower intercostal space, and that's going to be the tricuspid valve. It's going to also be to the left of the patient's sternum. And the next space that I'm going to, the next heart sound that I'm going to auscultate for is going to be between the 5th and the 6th, in the 5th intercostal space. It's going to be bisected with the midclavicular line. Oh wow, and that's a really nice, very clear sound. That's going to be the 5th sound, and that's called the mitral valve. Okay. Patient has a clear S1 and S2 sound noted with appropriate rate and rhythm with no problems noted. Let's see here. Would it be okay with you if I also listen to your lungs? Okay. I'm sorry. I know I made you a little bit red there. I kind of, sorry.
That's fine.
I really wanted to hear. Okay, can you, every time that I touch the stethoscope to you, will you breathe in and out, please?
Mm-hmm.
Okay. Thank you. Okay, can you lift your arm, please? Thank you. patient has appropriate rhythm and rate breathing, and lungs sound clear. There's no inappropriate sounds noted. The patient also used the appropriate muscles to breathe with no accessory muscles being used. Okay. Would it be okay if I listen to your bowel sounds?
Yeah.
Okay, thank you. Okay. First thing you do when you look at when you examine an abdomen is that you just look at it and see that it is bilaterally equal in all four quadrants, and there doesn't appear to be any distension, swelling, redness, or any heat in any one area that's different than the other. Okay. The next thing you do is you isolate for sound in the four regions. Patient has excellent bowel sounds that are appropriate and active. When's the last time that you had bowel movements, sir?
Today.
Okay, and how was it?
It was good.
Okay, and when's the last time that you voided or urinated?
30 minutes ago.
Okay, and how did that go?
It was good.
Okay,
No pain.
No pain, problems, burning, anything like that. Okay, very good. Okay, if you like, you can go and sit up. You good? Okay. Okay, would you be, do you feel okay?
Mm-hmm.
Would you be willing to walk for me?
Yeah.
Okay, thank you. Can you walk about 10 steps that direction or 10 steps back? Okay. Patient has a appropriate gait and appears to be bilaterally symmetrical with his muscles and also with his skeletal structure. You can sit down if you like. Okay. Do you, is your remote control? Okay. Would you like me to get you a drink or have one brought to you or a meal tray or anything?
No, thank you. I'm good.
Okay. Somebody will be with you soon to assess your to assist you with whatever problem you're having. And if you need anything, just call the call button and one of us will be back here to help you. And I'm going to wash my hands on the way out.